Anticholinergic medications for the Nclex. As usual, we'll start with a quiz. A client has received atropine sulfate pre-operatively. The nurse monitors the client for which effect of the medication in the immediate post-op period. Again, we're not going to use the decision tree here. We're just going to go straight into it. So our correct answer would be option number 3, which would be urinary retention. Remember, atropine sulfate is an anticholinergic medication that causes tachycardia, it causes the heart rate to increase, it causes drowsiness, it causes blood vision, dry mouth, constipation, and urinary retention. So you want to monitor the client for any of these effects in the immediate post-op period. Again, none of the other options relate to this medication, so we can eliminate them. So again, you want to remember that anticholinergic medications are contraindicated in the clients with glaucoma. So what are examples of our anticholinergic medications? There's your propantolene. So that's our propantolene here. We also have atropine, which we already talked about, is an anticholinergic. There's also scopolamine. Scopolamine is also an anticholinergic. There's also your benztropine, mesylate. And again, this is our belladonna. So this is another anticholinergic, probably a herbal supplement. So again, propantolene, atropine, and scopolamine, they are both anticholinergics and anti-muscarinic medications. They inhibit the action of acetylcholine at sites that are innervated by postganglionic cholinergic nerves. So what are they used for anticholinergics? We can use them for ophthalmic examinations. Remember, they can cause mydriasis or pupil dilation. So we can use them for ophthalmic exam. We can also use them to treat motion sickness because they address the nausea and vomiting. Scopolamine is often used for motion sickness. We could also use them preoperatively because they affect gastric emptying time and decrease gastric secretions. So you want to use them preoperatively. We can use our benztropine. So this benztropine could be used for Parkinson's disease. We could use atropine for bradyarrhythmias. Again, we could use propantolene for urinary incontinence. We also have oxybutynin. It's also an anticholinergic that is used as a urinary tract spasmodic. So that's your oxybutynin. So how do the anticholinergics work? They work by competing with acetylcholine at receptor sites in the autonomic nervous system. So these actions will be seen in the eyes. For example, they will cause relaxation of the ciliary muscles and cause dilation of the pupils. So you can see the effect would be to cause dilatation of the pupils in the eyes. With the GIT, what do you see? There's bronchodilation and decreased bronchial and gastric secretions. So we see bronchial dilations. We also see a decreased stomach mobility and gastric acid secretion. There's also decreased intestinal motility. So these are some of what you will see of the effect of anticholinergics on these system parts. It also increases esophageal sphincter tone. With the cardiovascular system, what are you going to see? It's going to cause increase in the heart rate, and it also increases the force of myocardial contraction. They can also cause or create tachycardia in clients. So it helps improve the heart rate. What are the side effects? Like we said, you're going to see blood vision. So you can see there's going to be blood vision. The client is going to complain of dry mouth. So you want to remember that. You also want to remember urinary retention. This is one major side effect. Again, remember that tachycardia we talked about. So you're going to see changes in heart rate, and there's going to be constipation. So the dry mouth, dry throat, constipation, they are all going to be the GIT signs you're going to be seeing. Again, you want to remember this. This one where I used to remember the anticholinergic effects. I can't wee, I can't pee, I can't stool, I can't drool. So you see how it rhymes. I can't wee, I can't pee, I can't stool, I can't drool. So that tells you I can't wee is a urinary retention. I can't pee, still your urinary retention. I can't stool would be the constipation, and I can't drool would be the dry mouth and the dry throat. So that's one way to remember it. So let's look at our nursing consideration. You want to monitor urinary output. Remember, we talked about urinary retention. There's that risk of urinary retention. Again, anticholinergics are contraindicated if a client has a diagnosis of glaucoma or hypersensitivity, or if they already have tachycardia due to thyroid toxicosis or cardiac insufficiency. Remember, we said tachycardia is one side effect. So if they already have tachycardia, you don't want to place them on this drug, which will further exacerbate their condition. Again, you want to use special caution if they have any urinary tract pathology, or if they are already at risk of a GI obstruction. Remember, we said it's going to be that constipation and slowing of the intestinal motility, so you don't want to place them on this drug. Again, you want to have the client take this drug 30 minutes before meals at bedtime or 2 hours after eating. Because of the dry mouth and all those effects, you want to provide good mouth care for this client. Assess bowel sounds. Again, presence of abdominal distension is what you should also be looking out for because of the effect on GI motility, that constipation we talked about. So you want to include preventative measures such as giving or pushing PO fluids and consuming plenty of fiber in the diet just to counteract that side effect. Again, you want to be aware of potential for additive anticholinergic effects, especially if prescribed another medication that has this anticholinergic activity. For example, antihistamines or certain antidepressants. So they could have that additive anticholinergic effect. Again, for this client, you want to monitor for drowsiness, no driving, no operating heavy machinery. So any action that requires quick reflexes should be avoided until their response to this medication has been evaluated. Again, remember, atropine sulfate is also used to treat a cholinergic crisis.